We could still do way better with our stroke care, and I will tell you how on this episode of One for the Road. Stroke care has advanced considerably over the course of my career. The things that we're doing now to quickly identify, screen, and transport stroke patients is leaps and bounds more advanced than anything that we accomplished in my first several decades as an EMS clinician, and I'm proud of that. But we could still do better. A recent study looked at close to 44,000 EMS runs where the patient's pre-hospital impression was documented as stroke. And it screened to see how often we are completing 6 patient care priorities that the study considered foundational to quality pre-hospital stroke care. And I agree with them. Those items are completing a neurological evaluation using any stroke screening tool, checking a blood glucose level, performing a 12-lead electrocardiogram, establishing the onset time or the last known well time, some type of pre-alert hospital notification like a stroke alert, and an on-scene time less than 15 minutes. What they found was that we are killing it on last known well time. 93% of the time, we're establishing it. Doing a stroke screen and checking a blood glucose, we're doing those between 80 and 85% of the time. But the other 3, a 12-lead ECG, pre-alerting the hospital, and getting off the scene in less than 15 minutes, we're accomplishing each one of those between 45 and 55% of the time. So lots of room for improvement there. And if you're wondering, we accomplished all 6 criteria on about 10% of all of our EMS stroke calls. Now, we could look at that with some cynicism or finger wagging, that you should do better. But I look at it this way. I look at it with excitement because I know that on my next stroke call, if I can manage to complete a neurologic evaluation, check the blood glucose, perform a 12-lead, establish the onset time, alert the hospital, and transport in less than 15 minutes, I am in the top 10% of all EMS providers for stroke care. So, are you in? I'm in. Are you going to be we can call it the 10%ers. Get it done. We are the 10% stroke care army. And may our numbers grow. I'm Steve Whitehead, and that is One for the Road.